So patient says, I shoot, the mosquito turns into a bear. Now this weapon, it's again gone waste. And you've seen this story happening about every single thing that's been coming up since years, since months, right? So it's similar with the virus. The virus can never have a medicine because it keeps mutating. Backed up by whom? Backed up by Carey Mullis, the one who invented the PCR. We all have taken this experience. Many patients we've seen that the evening time they are they are positive, and the next morning they do a test, they are negative. From one of the lab they get the test done, they are negative. From another lab they do it, they are positive. Multiple labs they do it, they are negative, they are positive. They are asked how many positive, how many negative. So patient says 3 negative, 1 positive. Great, now you are negative. So many times patients have experienced this. Let's understand about the symptoms. Any of the virus you take, symptoms like the fever, like the body pain, platelets may fall, nausea, vomiting, loose stools. This could be the possible symptoms. Which virus is it? Why is it that we cannot even tell which virus is this? We can know the sequence, but we cannot tell which virus is it. And why, if we don't know which virus is it, how will it have a particular specific medicine? How? Let's understand with a small example. You have a park outside your house, and one person saw that there is a claw, there is a panja. Aisha goes over there, like example, Aisha goes over there and sees the claw. Aisha comes to me and Aisha says, Sir, there is a tiger. Now, after some time, Kshitija comes to me. Kshitija says, Sir, there is a bear. Now, Kanchan comes running, happy and jumping. Kanchan says that, Sir, there is a wolf. And now Siddhi comes to me. Sir, there is a fox. We all have a different opinion. Take this example, related with the virus. We do not know what it is. We can never tell which virus is it. We can know the sequence, but directly we cannot tell which virus is it. Viruses keep mutating, we cannot directly tell which virus is it. How does a virus enter into the system? What are the mistakes that we do each time we have fever, ill symptoms, any of the virus? What are the mistakes? Let's understand. I'm sitting over here, this is a room, this is a consulting room, alright, there is a window, the sun rays are coming. Sun rays have a lot of bacteria, have a lot of germs. Sun rays are falling on my body. So I dust myself, I just put my hand over my hair, and we all know there are lots of viruses, lots of bacteria, germs, a lot of things in the atmosphere. Thousands of viruses. The virus enters into the system, it goes out. That's how the viruses are. It goes, it comes out. It goes into the system, again it comes out. This happens on and off. Let's take an example. The virus has entered into the system. Okay, it has entered into the system and it doesn't come out. It has parked itself in the system. What happens? What happens is first the Dr. Brain understands. Dr. Brain is very smart. Dr. Brain knows the tips and tricks to kill this virus. Dr. Brain is super smart. The nature is very, very awesome. It knows what should be done. So Dr. Brain, it knows that the virus cannot live in hot temperature. So what it does, it produces fever. My mentors, they always say the patient who has fever, it's a good sign because we know the body is fighting with the virus. And doctors, Ayurveda physician, naturopath doctors, they know what best should be done. My mentors, they got happy when they knew that it is fever, so it is a good chance that it is going to be fine now. So I did not believe in the beginning. Once we started seeing the cases, we started seeing the results. We understood even in the Jwar Chikitsa Sutra, before a medicine there is langan, fasting, different types of fasting, different types of method about which a doctor or Ayurveda physician guides you the best with. And at the right time, the right medicine, be it a Tribhuvan Kirti or a Samshavani or any drug medicine, the right medicine used at the right time, patient is relieved. So you don't require medicines first, you require the right concept, the right move at the right time. So over here, the body produces fever, what do? You take a drug, you pop a drug because having fever, having hot temperature, it's not fashionable, isn't it? It's not fashionable, you take the drug, fever is gone down, virus says, thank you, I was about to die now, but you just saved me. On another instance, you may have a vomiting episode. Vomiting is not fashionable for you, so what do? You pop a drug, vomiting is suppressed, virus says thank you. There may be another instance, you have the loose stools. You have loose stools and it's not fashionable, of course. Right? So you take a pill, you take a drug, and what happens? It stopped. Virus says thank you so much. In today's time, we see a lot of mucus in the throat, in the nose. Patients are like, which medicine should I take? It's not about the medicine, it's about the right move, the right nutrition, the right things that you need to do, the right concept of Ayurveda, the right principle. That's very, very important. What do? We take a syrup, It's suppressed. Virus says thank you. You have another problem, you take this medicine. You have another problem, take this drug. You have it, keep on taking it. So, what is important is that the virus is saying thank you because it is not being killed. So, we need to understand the right move to be taken. All of this is explained in Ayurveda. My mentors, they always say this one thing: the one who doesn't know history or studies history, gets into the depth of history, can never repeat history. The one who doesn't know history can never repeat history. So it's very important to know about the naturopathy, the Ayurveda, and all these natural healing methods which have great results. Even in the emergency care centers, these methods, along with different medications, different procedures, patient has recovered faster. It's all about patient's recovery, patient's result. Even Ayurveda as a whole and soul, as an individual treatment, it has shown amazing results. Patient has recovered with, including the other treatments. Of course, results are outstanding. So it's high time to come together and spread the knowledge and work something for patient's convenience. Very important, all of these concepts that I just shared right now, or the 3-day immune boosting diet, the 6-day immune boosting diet, the Chikitsa Sutra of Jwar, all these, immunity boosting diet, the immune boosting diet, these are the diet, these are the concepts right from the 3rd day, right from the 6th day maximum. Patient is out from the majority of the symptoms. Major symptoms, patient is out with all, not much of complications, not much of hard work, not much of struggle. Patient is out in the long run. Every once in 45 days, this 3-day immune boosting diet or 6-day immune boosting diet, it can be done. It can be taken. Simple foods, nothing fashionable. Simply what you have at home in the right way. Goals can fail, system never fails. So you need to have a strong system and not just goals. System with a goal, outstanding result. So what is important during fever or any of the ill symptoms? Once in 45 days, if you follow the principles of Ayurveda, if you follow the 3-day or the 6-day immune boosting diet explained in naturopath, explained by different natural healing methods, the results are outstanding. Let me know in the comment section by writing a D or a diet, and we will share this 3-day immune boosting diet or a 6-day immune boosting diet backed up by great personalities like Colin Campbell, there is Kelly Willis, Yogesh Mittalji, Dr. B.M. Hegde sir, many of the legendary Ayurveda physicians, and of course our acharyas that have explained all of these concepts for our well-being. This is all for now. Do like and share this video further. Until next time, from